Hello, my name is Chioma I, and my topic is on hand hygiene compliance by staff at a Los Angeles County hospital. A brief background. Hand hygiene is a critical aspect of infection control in healthcare settings, as it plays a vital role in preventing the transmission of harmful pathogens between patients and healthcare workers. In Los Angeles County Hospital, ensuring strict adherence to hospital-wide hygiene protocols is essential to maintain a safe and healthy environment for both staff and patients. Standard training on hand hygiene practices has traditionally been employed to educate healthcare staff on proper hand washing techniques and infection control measures. However, achieving and sustaining high compliance rate with hand hygiene protocols can be challenging due to various factors, such as busy work schedules, lack of awareness, inadequate reinforcement of the importance of hand hygiene. During this presentation, I will address these challenges and implement a change to increase hand hygiene compliance. Significance of the problem. Ensuring high staff compliance with health facility-wide hygiene is crucial due to its direct impact on patient safety and public health. Healthcare-associated infections have a significant global impact, affecting millions of patients annually and leading to increased rates of illnesses and deaths, resulting in higher healthcare expenses. Studies indicate that hand hygiene compliance in many facilities is alarming low, with an average of 17% compliance reported. Low-income countries typically exhibit even lower hand hygiene compliance, hovering around 9%, while economically well-performing nations rarely exceed 70%. The World Health Organization highlights that hand hygiene plays a crucial role in preventing more than half of hospital infections. Improving staff compliance to hand hygiene protocols is essential to reduce the incidence of health-acquired infections, safeguard patients' well-being, and mitigates the financial burden on healthcare systems. EBP project question. P. Patient, Los Angeles County Hospital staff. I. Intervention, comprehensive hand hygiene campaign. C. Comparison, standard training. O. Outcome, raise compliance rate to 95%. T. 1 month. In the environment of healthcare facilities like Los Angeles County Hospital, ensuring patient safety is a paramount. One critical aspect of patient safety is infection control, and a fundamental element of this is a proper hand hygiene. However, despite the significance of this practice, many hospitals face challenges in maintaining high compliance rate among their staff. Traditionally, hospitals have relied on standard training to educate their staff about hand hygiene practices. While this approach is valuable, it is often falls short of achieving consistent and sustained compliance. This brings us to the concept of comprehensive hand hygiene campaign, an intervention that seeks to revolutionize the way hospitals approach this issue. Imagine a scenario where the Los Angeles County Hospital takes a proactive step towards improving hand hygiene practices among its staff. This comprehensive hand hygiene campaign goes beyond mere training sessions. It is a holistic strategy that integrates interactive workshops, strategically placed informative posters, timely reminders, and an individual feedback mechanism. It aims to create a culture of awareness and accountability around hand hygiene, elevating it from a routine practice to collective commitment. The heart of this campaign lies in its capacity to address the root cause of its noncompliance. Workshops provide a platform for staff to engage in hand learning, fostering a deeper understanding of the significance of their action. This campaign is not merely about short-term results, it's about fostering a sustainable culture of hand hygiene that extends beyond the initial amount, thus safeguarding patients and creating a safer healthcare overall. Review of the literature. I use databases including Scopus, Medline, PubMed, Google Scholar, and CINAHL to gather relevant data on the topic. I came across many sources from these various data archives and selected the most important to drive my project. Following the literature exploration, the essential terms were infection management, staff hand hygiene, patient safety, healthcare associated infections, staff training, education, and hospital hygiene compliance. Summary of evidence, common research techniques, mixed methods, randomized controlled trials, and direct observation. Heimerschmidt and Manscher 2019 used the mixed method techniques, while King et al. 2016 utilized randomized controlled trials. Staines et al. 2018 and Chong et al. 2021 conducted their research through direct observation, and Grayson et al. 2018 collected data through longitudinal study. The samples employed were unique to different studies. For instance, Chong et al. Targeted patient safety campaigns mainly on hand hygiene. Nurses and any other healthcare providers were also frequently used as samples through interviews surveying their hand hygiene practices. Summary of evidence, samples and variables, hand hygiene techniques, nurses and clinicians, and healthcare givers. Chong et al. 2021 targeted patient safety campaigns mainly on hand hygiene. Nurses and other healthcare providers were also frequently used as samples through interviews and surveying their hygiene practices. Hammerschmidt and Manser 2019, King et al. 2016. One of the studies, they used a different sample assessing the information provided by the World Health Organization regarding health hygiene over 8 years among Australian healthcare givers. Summary of evidence, observations, hand hygiene opportunities versus hand hygiene compliance, level of compliance to World Health Organization, multimodal hand hygiene improvement techniques, reduction of hospital-acquired infection. Han et al. 2020 observed the percentages of hygiene compliance against the availability of hand hygiene opportunities. Another study by Boykovich et al. 2021 studied different levels of hand hygiene compliance among healthcare workers in organizations that employed or failed to follow World Health Organization multimodal hand hygiene improvement techniques. Another approach to analyzing the topic by Imram et al. 2021 analyzed health awareness on reducing hospital-acquired infection against level of hospital-acquired illnesses, which highly depend on hand hygiene. Recommended best practice, comprehensive multimodal hand hygiene campaign, and also a just-in-time coaching campaign, which will be the name of the campaign to increase the hand hygiene compliance to 95%. Bokovich et al. 2021, Heimerschmidt and Manser 2019 have shown that a combination of interventions can significantly improve hand hygiene compliance rates and reduce hospital-associated infections. Pan et al. 2020 added that some techniques to employ in hand hygiene campaigns include using video clips to educate people on safety practices of hand washing. This could be employed to reach more people and keep reminding them of the importance of proper hand washing techniques. Policy and protocol for practice change. Effective implementation of a practice change in hand hygiene requires a multi-phase approach that incorporates clear policies, engaging educational materials, and interactive awareness initiatives. Let's delve into how a combination of video clip presentation, brochures, and awareness posters and education meetings can contribute to a successful transition. Video clip presentations. A well-crafted video clip can serve as the cornerstone of your hand hygiene practice change initiative. This video should not only highlight the importance of hand hygiene, but demonstrate proper techniques and emphasizing key moments such as before and after patient contact. Brochures. Brochures serves as a handy takeaway that staff can review at their convenience. These should include essential information on hand hygiene protocols, the rationale behind the change, and the benefits of it. Awareness posters. Strategically, practice awareness posters serve as a constant reminders of the practice change. Education meetings. Interactive education meetings foster an important open communication and shared level learning. These meetings can feature guest speakers, infection control experts, or experienced practitioners who can address questions and concerns. By integrating these components into your practice change initiative, you create a comprehensive policy and protocol that leaves no room for ambiguity. The combination of visual learners through clips, tangible resources like brochures, constant reinforcement through awareness posters, and interactive educational meeting forms a cohesive strategy. The success of this approach lies in between various learning styles. Reminder, consistency is the key. Regular updating like video clips, brochure, and posters to include new highlights and feedback helps initiative fresh and relevant information. Policy and protocol for practice change. Direct observation of staff hygiene practices and data on hygiene compliance will be collected longitudinally over the 1-month intervention period. Feedback from staff, patients, and other stakeholders will be collected through electronic surveys and analyzed to make necessary adjustments for better results. Implementation plan. Step 1. Campaign planning, 3 days. A multidisciplinary team comprising hospital administrators, infection control specialists, healthcare educators, and staff representatives. Step 2. Staff preparation and training, 2 days a week. In collaboration with department heads, the Human Resources Department will communicate the training schedule and requirements to all healthcare staffs. Step 3. Direct observation and data collection throughout the month. Designated observers trained by infection control specialists will conduct regular direct observation of staff hygiene practices within the month. Step 4. Staff representative feedback and continuous improvement, ongoing, to gather input on the campaign effectiveness and identify any challenges. Step 5. Reporting and accountability, ongoing. Regular reports on hand hygiene compliance rates and campaign outcomes will be generated and shared with hospital administrators, department heads, and relevant stakeholders. Evaluation plan. The evaluation plan for the proposed comprehensive hand hygiene campaign at the Los Angeles County Hospital involved a structured approach to measure the effectiveness of the intervention in achieving the desired outcomes within the designated time frame of 1 month, which comprised of the baseline assessment, intervention implementation, data collection and analysis, feedback and reflection, outcome and measurements, reporting and action. The evaluation plan involves a systemic process of assessing, implementing, and measuring the impact of the comprehensive hand hygiene campaign by comparing compliance rates before and after the intervention. The hospital administration can determine the success of the campaign in achieving the desired outcome of significantly raising the staff compliance with hospital-wide hygiene protocols and reaching the target compliance rate of 95% within the 1-month time frame. To summarize, during my preceptorship, I realized the importance of hand hygiene and the need for a multidisciplinary approach to improve compliance among staff. I witnessed positive effects such as decreased infection among patients and reduced healthcare costs as a result of this intervention. Additionally, I observed different levels of involvement from various healthcare professionals in creating efficacy, including nurses, physicians, infection control specialists, quality improvement teams, patient safety officers, and administrators. The collaboration and commitment from these stakeholders were instrumental in promoting and sustaining proper hand hygiene practices. These are my references, and this concludes my presentation. Thank you so much.